if you stop benzos suddenly, you get fits and it can kill you, incidentally. So that's why you have to withdraw slowly.
Some of these symptoms were really terrifying for the people suffering them. And in some cases, people were actually becoming disabled. Isn't that the case?
Oh, it certainly was. I mean, because these symptoms could be quite overwhelming, were very severe. There were even suicides. People got very depressed, and led to the breakup of families, marriages, you became impossible to work. You lost your job, you lost your income very often, and also it was difficult to get any compensation because nobody realized it was a real illness.
Professor Leder has described this as a medical disaster. Would you agree?
Yeah, this was a real, and still is, a real tragedy.
But just to be clear on the issue, you say that at the same time, not very many facilities were being provided around the country to look after these people. And these people were measured in hundreds of thousands, millions?
Well, we think from the GP studies, at least millions in the country. And so the patients themselves usually started setting up their own support groups. And it was they, and still is, support groups who get more people off and give them more support than any doctor, because there are no NHS clinics now.
One of the difficulties in getting people to focus on the dangers of benzodiazepines appears to be the fact that some people can get off the drugs relatively easy, while others suffer terrible agony.
Yes, and the point is that if we could predict who is going to withdraw easily and who is going to go through agonies, we could reserve the benzodiazepines, which do have some positive effects, just for those who are not going to run into problems. But we can't predict, and therefore you have to look at the totality of the distress that is caused.
In 2010, Britain's Independent newspaper opened up another very disturbing chapter of the story, revealing documents from the British Medical Research Council, officially kept secret for nearly 30 years, about Professor Leder's attempt to get potential brain damage from the drugs properly investigated. That long ago, he'd carried out 2 studies of patient brains which showed worrying abnormalities.
Well, we knew that alcohol, that's been well researched, taken chronically in high dose, abused in other words, can cause subtle brain damage, which is only partly reversible. I always had lurking in the back of my mind that these people are taking their benzodiazepines for many years, decades. Maybe it's having an effect on the brain as well. So we used the imaging techniques available at the time and looked at a group of patients who hadn't abused alcohol but had been on benzodiazepines for a long time. And we found some anomalies, some abnormalities which concerned us. And we thought, in view of the extent of usage of these benzodiazepines, there were millions of people, literally, who might be at risk, and we needed to go into this in more detail. I asked for the Medical Research Council to look into this, and they agreed and set up this subcommittee which met, and we looked at the evidence. The report went to the Neurosciences Board of the Medical Research Council, but nothing further was done about it.
Can you understand why the results of that meeting, the record of that meeting, was kept secret for 3 decades?
Well, it wasn't secret in the sense that we weren't adjured to secrecy. There was no Official Secrets Act. And I was very surprised to find out later that those minutes hadn't been released. So I don't know what was going on, but there was concern about it. And I know that I think Professor Heather Ashton, and I'm sure you'll ask her that, she also put forward a proposal which was turned down.
Both you and Professor Leder put research proposals to the Medical Research Council. He wanted to investigate some prima facie evidence he had of structural damage to the brain from benzodiazepines. You wanted to follow up with a research group based on
Well,
your clinic and a proposal to put to
yes.
the Medical Research Council for a very authoritative study, and they turned that as
We
well.
never got money for it. I had a very good sample of people because I had 300 patients at my clinic who had followed for several years. I knew all their brothers, sisters, spouses, you know, people who'd had a similar upbringing, so you couldn't say, oh well, you're not you've got a selective group. And so 300 who were on benzos, 300 relatives or spouses who weren't. We could have done MRIs, studies on that for structural things. We could have done a lot of cognitive tests to see if they were impaired, because something I haven't mentioned, which is perhaps the greatest tragedy of all, is when people are on benzos, their thinking is impaired and they're prone to traffic accidents, making bad decisions, all sorts of things, poor memory. And so we could have looked for that, see if that recovers, and other things with looking at brain function with things like EEG and magnetoencephalography as well, which are ways of looking at the way that neurons in the brain are firing. We could have done all that on a large number of patients, and I tried the MRC and the Wellcome Research Council and the Medical Research Council and the Wellcome. Never got the money for it. I don't think it was considered as a serious enough condition. I don't know why, but...
In Newcastle, Professor Ashton wrote her now famous manual on benzodiazepines, describing the symptoms and showing how to withdraw slowly. It's free on the internet. A book could have made her a fortune. It's the Bible worldwide for victims of doctor-induced benzodiazepine illness. Professor Ashton became a medical advisor and friend to victims everywhere. This is a bound volume of some of the thousands of letters and emails she's received from all over the world, made by a grateful patient. The consultant who recommended I take Valium for Meniere's disease brushed aside my concern, saying it was a most maligned drug that could be a preventative against Meniere's attacks. He stopped prescribing Valium for Meniere's now, a lesson learned at a huge cost to me. When I started getting darting pains in my legs, I searched the web and in shock found the Ashton Manual, which explained what was happening to me.
You wrote the Ashton Manual, which was published on the web. It's about benzodiazepines, how they work, and also about how to withdraw from benzodiazepines. Why did you do that? Was it in response to a very big need?
Well, yes, because the patients seemed to know more than the doctors. All of them said the reason they'd come here was they got no help from their GP or from a psychiatrist. I had patients referred from psychiatrists even. And the patients seemed to know better than the doctors. And so I wrote that manual for patients who couldn't get help from their doctors. It was for them. And the interesting thing is, although patients all over the world have snapped it up, the doctors still don't read it. Actually, one thing we haven't mentioned yet is that in all the literature telling you how to prescribe drugs, they all say that benzodiazepines are for short-term use only, 2 to 4 weeks maximum. And even the company that makes them says that, but it's just that nobody takes any notice.
How many languages is it translated into now?
Well, it's over 12.
Over 12.
There's a Japanese one. There's all the European languages.
It has been used by literally millions of people all over the world.
I presume so, yes. I mean, if you look at the prescription levels, interestingly, Japan has the highest in the world prescription levels at the moment of benzodiazepines. And they're lapping it up. And, you know, all these things have been translated by people voluntarily. I mean, they've never been paid for it or anything like that.
In the United States, the National Institutes for Health report in this bar chart that drug overdose deaths involving benzodiazepines have risen sharply over the past 13 years, going from over 1,000 in 2001 to about 8,000 in 2014. Meanwhile, in December 2015, the American Public Health Association has warned that both benzodiazepine prescriptions and quantities prescribed have increased considerably. Interventions, they say, are needed to reduce the use of benzodiazepines or improve their safety. The state of Massachusetts is considering a new law to strictly limit and control prescription, requiring detailed warnings by both doctors and chemists, with black box warnings on benzodiazepines like cigarettes.
Suicides have taken place
Yes.
with people suffering withdrawal symptoms maybe while they're still taking the
Yes.
drug, or alternatively going through this terrifying period where they're reducing and stopping. Is that common? Have you come across those kind of suicides?
It is very disturbing, and there have been suicides. You think, can't cope with this anymore.
I suppose suicide is a possible outcome, and I think it's more of it is maybe hidden because people don't try and come off the medication, don't come off the tranquilizers. They think it's helping them, and they go on, and in fact they go to the grave with a bottle of tablets beside them. I think it's that's where the hidden amount is. It's you don't know that you've got problems until you try and stop.
Also, that they cause depression. You know, what with pain and depression and anxiety and the whole lot, what is there to live for? Your marriage is broken down. I mean, it's not very high, but there have, and I don't think anybody's counted it either, but there have been suicides, usually in withdrawal, but sometimes when you're still taking them.
But the numbers might be bigger than people think, because these would be hidden as well. It's quite possible that they wouldn't be reported as suicides.
Well, benzodiazepines are implicated in the big suicide studies. Most people, if they're going to commit suicide, they take a big drink, they take an antidepressant, they take a benzo, they take a whole lot. And the one thing about benzos that made them so safe was that they didn't stop your breathing, they didn't depress respiration, like barbiturates do. But if you mix them with other drugs, painkillers, painkillers or antidepressants or other drugs that depress respiration, the additive effect can kill you. So whether they cause it or not, we don't know. But you can be suicidal just on a benzodiazepine alone.
Cruel reality intervened in April 2016 when 49-year-old building conservationist Paul Rayner from Somerset took his own life 10 months into a painful withdrawal after stopping the benzodiazepine clonazepam, also known as Klonopin. Paul had to give up his job, which he loved. Here he's working on Truro Cathedral. Paul's side effects were shocking. His former partner and close friend, Brooke Fenton Hale, describes how he lost his sharp mental skills and felt his brain crashing against his skull, shaking and vibrating every day. He had pains and vibrations in his legs and body. He suffered tinnitus and nightmares. In the shower, the water hit his skin like needles. He spent days lying on a bed or a sofa, a far cry from the happy young man with his first daughter, Alice. He couldn't earn a living, and he couldn't take the physical or mental pain any longer. His mother, Janet Rayner, a former nurse, is very angry about what legal medications did to her son.